Thalassemia major is a really regimented health condition. As a patient, you have to be accessing hospital care every 3 to 5 weeks or so for your blood transfusions. And patients really, after their blood transfusion, they often will feel a lot better and have energy. But by the time they get close to their transfusion, this is roughly about 3 weeks, 4 weeks later, you have to think about somebody who's bleeding a pint of blood a week. The thalassemia patients are losing a pint of blood a week. They're not bleeding it, but it's being broken down. So the rapidity of that fall means that they get a lot of symptoms. They'll get back pain, bone pain, fatigue, and all of these things mean that by the time they're ready for their transfusion, they will be pretty exhausted and they'll be back in for their transfusion. So it's really difficult. What I would say, and this is what I do with my patients, is that if my patient's doing really well, they've got good iron control, and they're complaining of symptoms, I'm just going to simply put up their transfusion threshold prior to transfusion. And I often run my patients between 95 and 105 grams per litre. That's a hemoglobin that a thalassemia trait patient has. And what you would hope to do by doing that is to reduce the amount of bone pain and fatigue that patients get. And that can help a lot of patients. There are very few patients that I do let run at about 110. But those patients have also got extramedullary hematopoiesis. So they've already got tumors that have developed from bone marrow expansion. And so those patients, I will let them run much higher. But the average patient should be really aiming for a hemoglobin of somewhere close to 100 prior to transfusion, just to really prevent complications from developing, but also to improve their quality of life. I think the other thing that affects quality of life is side effects from iron chelation, and we just don't really talk to patients about what sort of side effects they're getting from their iron chelation. There are lots of things you can do, like changing the timing of the medication, changing the dose of the medication, to really kind of help manage side effects. But we often just don't ask, and hence we don't know that the patients are having those problems.